estimated 80 to 100 million Americans are living with fatty liver disease, and many have no idea they have it. Here to tell us what puts you at risk, how to protect your liver, and the foods you should be eating is registered dietitian and nutritionist and director of Nixendo, Sasha Bayat. How are you?
I'm so good. How are you?
Oh my gosh, this is a big deal.
I know. It's really crazy.
So first off, what exactly is fatty liver disease?
So fatty liver disease is a condition in which your liver stores excess fat. There's two main types. There is MASLD, which was formerly known as non-alcoholic fatty liver disease. So that's more metabolically related. And then we have an alcoholic associated one. The more predominant common one is MASLD. That actually affects, it's estimated up to 38% of the adults worldwide. So more than 1 out of every 3. And the liver is the main site of so many important things in the body. When we eat, it helps us activate some of those vitamins, those minerals, helps with our heart health. It actually has over 500 functions in the body. Yeah.
Who knew?
Yeah.
Now we do, I guess. It's called this is always a terrifying phrase to hear. It's called the silent disease. Why?
So it's called the silent disease because it often presents without symptoms. So many people do not know that they have it. And when it does progress, some people might have some abdominal pain or they might feel really tired, but those symptoms are pretty general anyways.
Yeah.
Sometimes a lab test can come back normal. So early screening is very, very important because we want to prevent the progression of it.
And you're looking at the symptoms here right now. You can see fatigue,
yes.
Dull ache, things like that. I mean, they're not.
I these every morning.
They're a little. I know that's what I'm saying. Like I'm tired. They're mostly pretty subtle.
Exactly, yeah. So some people end up finding it incidentally. So they're going in for maybe to get their gallbladder checked or getting some blood test for something else, and then they incidentally find it. So early screening, regular screening is really important to make sure, again, that we prevent the progression of it.
What is the demo? Who's at risk with this?
So anyone can develop MASLD, but the populations that are higher at risk are people who already have metabolic conditions. So obesity, think heart disease, high cholesterol, high triglycerides, diabetes. So it's really, really important with these people who have metabolic conditions to get screening regularly.
And it's a lot of people that it's taking care of yourself.
Yes,
it's just incredibly important.
Yeah. And actually the really exciting news is that diet and lifestyle is the first line treatment for fatty liver.
Eating healthy.
Exactly.
Awesome. I love it. Here's a question. Can it be reversed?
Yes, that's the great news, is especially in the early stages, there's certainly a chance that you can reverse it. So adopting a healthy lifestyle pattern, getting at least 2.5 hours of exercise per week, and then losing at least 5 to 10% of your body weight is enough to start reversing some of the fatty liver.
It is, though. You said before, though, it is food intake. You're seeing exercise.
It's really amazing. Yes.
Limited sugars, eating more fiber, vegetables, healthy.
Exactly.
And luckily nowadays, those things are so much more accessible in a way that's like easy. Like you could put it comes in powder form.
Yeah, exactly.
Like you can make a nice, delightful smoothie in the morning, and
yes.
you're good to go. What kind of diet is best to help prevent? Like, what's the specific diet?
So the strongest evidence is Mediterranean lifestyle pattern. So an abundance of fruits, vegetables, lean proteins, healthy fats, fatty fish. These foods are really high in vitamins and minerals that help fight inflammation, high in fiber as well. Getting the 2.5 hours of exercise. So the really exciting news is that you can start at any moment adopting these patterns, and you actually don't even need to see weight loss happen to see the effects of the reversal.
That Mediterranean diet.
I know. It's the answer to everything.
It really is. Just olive oil.
We need to move to Italy.
Garbanzo beans, something. And a lot of protein, a lot of fiber, things like that.
Yes,
that is the key.
Yes, yeah. So making these changes right away is super important. Again, the liver is the site of everything in our body, so doing everything that we can to take care of it. And like we just said, it starts with your fork, and you can start right away. 500
jobs and purpose. Unbelievable. Yeah. Amazing. Thank you so much. We appreciate it. Thank you, Sasha. For more information about this silent epidemic, go to liverfoundation.org. Coming up next, are you Team Italian cheesecake or Team New York style? We're celebrating National Cheesecake